Hi everyone, welcome to another episode of CKD podcast where we discuss all things health and wellness. I'm your host, Ifeda Osutoyin, your in-house pharmacist, and on today's episode we're going to be discussing an aspect of chronic kidney disease and its relation with your nutrition.
Chronic kidney disease, or CKD, affects millions of people worldwide, often progressing silent. So managing CKD before it leads to dialysis is crucial for a better quality of life, as protein metabolism becomes an added burden with individuals who have CKD, as it can accelerate progressive decline in kidney functions. How does this happen? Because protein is the source of nitrogen in the waste generated by the kidneys. Interventions that slow down the progression of kidney function decline and delay the initiation of dialysis for patients living with CKD are essential for a better quality of life. Renastal tablets, a breakthrough nutritional therapy that is beneficial for CKD patients. Renastal combines ketoanalogues and essential amino acids to prevent and manage the damage that results in faulty protein metabolism. Renastal as a tablet, taken with a very low protein diet, helps slow the progression of CKD, thereby reducing the risk of initiation of dialysis. By replacing essential amino acids without adding nitrogen waste, Renastal can help you maintain the protein balance your body needs whilst protecting your kidneys. Renastal, you are not just managing your kidney health, you are improving your long-term well-being. Ask your doctor if Renastal is right for you, because together we can take steps to protect your kidneys and improve your life. Renastal, helping you live better with CKD. For more information, contact the Circle Direct podcast on YouTube.
Now, we know that when it comes to people that are living with chronic kidney disease or CKD, having the right amount of nutrition or ensuring that they don't exceed a particular nutrition, it goes a long way in keeping the kidneys in good condition. And that means that there are some items that is in the food of a patient with chronic kidney disease that must be properly monitored. And these things are like your protein and some other nutrients. So today we're going to discuss the role of nutrition and having a proper diet plan to ensure that you delay the progress of that disease. So for today, we're going to now talk about how we can connect having informed choices with good health resilience. We are focusing on the crucial impact of nutrition on chronic kidney disease. Now, for those managing chronic kidney disease, every bite counts. You can't just have your meal and then think that, oh, since I have chronic kidney disease, I can do whatever I like. Every amount of protein in your diet goes a long way in either delaying the disease or accelerating the progression of that disease. So today's podcast, we're going to break it in several segments. The first segment, we're going to talk about how to understand the role of nutrition in people living with chronic kidney disease. So before we talk about the role of nutrition, let's define chronic kidney disease. Now, what is CKD? It's basically a condition whereby the kidneys are losing their abilities to filter out waste from the body. So we know that as we eat every day, even though our food supposed to provide nutrients to the body, it also releases toxins that are damaging to the system, and that is the role the kidney should play in filtering out these toxins from the blood. So when the kidney are losing the ability to filter it out, very soon you start having your body filled with all these toxins, which can lead to other diseases and other medical conditions. So the key component of kidney disease management is in our diet. Now, when we're not just going to talk about diet, but we're going to be specifically talking about the nutrients that we should eliminate or reduce to reduce the workload of the kidneys and thereby prevent complications. And of course, when these complications can be prevented, it will reduce your chances of needing dialysis later in the future. So now, when we talk about CKD and its relationship with nutrition, what are we saying? We're going to be focusing on some specific nutrition that you must watch out for, such as protein, sodium, potassium, and phosphorus. Now, the reason why we are measuring all these four nutrients is because we want to reduce how much load that the kidney is exposed to. We don't want the kidneys that are already in their compromised state to be overloaded and strained furthermore, whereby these additional strains can lead to more damages on the kidneys. So for protein, for instance, we know that protein is crucial because protein is necessary for tissue repair. It's also good for the heart. But at the same time, when there's excessive protein in the diet, it can further damage the kidneys. Why? Because it releases a lot of waste and also nutritional and nitrogenous products which are harmful for the body. So by the time you are monitoring the amount of protein you take daily, it makes sure that the kidneys are well taken care of. So this is going to bring us to the concept of very low protein diet. Now, for the very low protein diet, what we mean is that for people that are living with CKD, they have to monitor the amount of protein that they have daily when they want to have their meals. Generally, for any individual, whenever you want to have your diet with your protein, it is recommended that you have at least 0.8 grams of protein per kilogram of body weight. But for a patient with chronic kidney disease, you must reduce that amount to as little as 0.3 or 0.4 grams per kilogram. This would significantly reduce the amount of waste and other byproducts of proteins that is released from that diet, which will now lessen the burden on the kidneys to filter out these toxins. One of the challenges that we have seen with this sort of diet, that is the VLPD, is that even though you are going to reduce the amount of protein you are taking, you must also ensure that the amount of protein is adequate for your own body's nutrition. Protein is essential. Like I said earlier, you need it for cell repair, you need it for your immune function, and also for your muscle maintenance. So cutting down it drastically can actually lead to some nutritional deficiencies. So what we must do with this is that, apart from taking the recommended amount of protein for people living with chronic kidney disease, you must now supplement it with things that we call keto acid analogues. Now, these supplements, what they do is that they would provide your body with the necessary building blocks that the body needs to prevent nutritional deficiencies. Because at the end of the day, if you are on this CKD stage and then you are also lacking in protein, it can worsen your medical condition. But the thing that we have to realize is that when you are on this diet, you need your healthcare professional to guide you, because there must be proper balance between your nutritional needs without putting too much stress on the kidney. Now, the next segment we're going to go to is now where we're talking about what other factors must we consider when we are looking at the dietary adjustment with people living with chronic kidney disease. So, I mentioned protein. Now, I'm going to talk about the other nutrients that is essential but must be limited in people living with CKD. And these are sodium, potassium, and phosphorus. Even though they are essential, these things must be given at lesser amounts so that it will not put a burden on the system. Now, let's us go to sodium. We are very, very aware of sodium. Sodium is found in our salt. We use sodium to season our food. It puts taste even in our meals. However, we also know that for people that are living with hypertension, when there's excessive amount of sodium, it can lead to retention of fluid. And when there's already retention of fluid, you are putting strain on the kidney. So it can further damage the kidney. So ideally, you should go on a low sodium diet. So that means that things like canned food, processed food, or even eating out, you should drastically eliminate it. Do things like fresh herbs to season your food, and try as much as possible to make your meals at home. Coming to potassium. Potassium is another nutrient that is very, very essential for your diet, especially even whether you are with a CKD condition or you are having proper kidneys. But at the same time, when the level of potassium is too high in the system, it can lead to dangerous health and heart issues. So it must be encouraged by patients that when it comes to food that are rich in potassium, you must drastically reduce them. Now, one of the fruits that are rich in potassium is bananas. So if you are someone that is living with chronic kidney disease, then it's advisable you really monitor your bananas, or even if preferably you exempt bananas from your meals. Now we are going to go to phosphorus. Phosphorus is usually found in our sodas, it's found in dairy, it's also found in a lot of processed foods. But one of the things that we have discovered with phosphorus is that when there's a high level of phosphorus in the body, because your kidneys can't filter out your blood properly, then it leads to weakened bones. And the reason why is that excessive amounts of phosphorus leads to calcium being removed from the bones, and then of course your bones will now become brittle, and then it can lead to breakages. So you have to reduce the amount of phosphorus rich foods you take. So processed food also, reduce them. Go for things that are wholesome. So that means that your whole grains, take more of vegetables that are low in phosphorus. So now let us now talk about the personalizing of a diet for people that are living in CKD. Now, CKD has different stages. We have from stage 1 to stage 4, which is the end stage condition. And that means that the type of meal that you're going to prepare for somebody that has stage 1 is going to be totally different from the kind of meal they are going to prepare for the person that is already at the end stage. So when you're looking for the type of meal you're going to provide for those that are with a stage 1 condition, it can still be mild. There are still some minerals like your potassium that you can still include into the diet. But now for those that are on the stage 4, that is the end stage kidney disease, whereby most likely the patient is already on dialysis, it's very essential that such patients are on very low protein diet. It is crucial that whenever you have come across a patient that has CKD, it's not a one size fits all criteria. One patient might still be able to take some amount of protein, while another patient might really benefit in taking what we call the ketoanalogues. But as you're going to be including this into your patient's meal, for if you are a healthcare provider, it is very, very essential that such patients should seek the counsel of the doctor, so that they don't just go about managing the condition on their own, because such can actually lead to deficiencies at the end of the day. So how does nutrition, with the help of a very low protein diet, delay the onset of dialysis? Now, so the ultimate goal with this kind of nutritional plan is that it will preserve the function of the kidney for as long as possible, because first of all, when the kidneys are damaged, it can be life-threatening. Then secondly, the cost implication of being on dialysis cannot be borne by a lot of individuals, and that can quicken the rate of fatality. So by minimizing waste production and supporting overall kidney health through targeted dietary choices, patients can have a better quality of life. They will experience fewer symptoms, and of course, it might even delay the need for undergoing dialysis at the end of the day. So for people with CKD, nutrition can be one of the most powerful tools in managing the disease. And while it takes effort and planning, the benefits of preserving kidney function and living with fewer symptoms make it well worth it for such a patient to commit to this kind of nutritional plan. So as we have said today, I believe that everything you've heard is going to really impact your knowledge of people living in CKD. Now, you might be like, okay, I don't have CKD, or I am not having any kidney issues. But at the same time, you must realize that sometimes even people living with CKD is not written on the face, because Nigerians generally don't go for routine checkups. So you have to take your health into your own hands. You don't have to wait until you have the condition before you start reducing the intake of processed meals, or even reducing your salt intake, making your cooked meals, incorporating vegetables and more fibrous meals into your diet. Because at the end of the day, you want to live a productive and well-balanced life. It's all about you eating just right. When you eat right, you are going to support the kidneys, you are going to ensure that they function well, and you will give them the ability to perform their actions as long as possible. So whether you are following a very low protein diet, or you just want to start making small adjustments in your eating habits, these strategies in your diet goes a long way in promoting proper kidney health and making a great difference on your journey as someone living with chronic kidney disease. Remember that with all this health journey, consulting your healthcare provider or your dietitian is very essential before you make these dietary changes. By harnessing the power of food as medicine, people with chronic kidney disease can have a better management in their health condition and enjoy a richer life. So as we come to the close, remember very well that just because you have CKD doesn't mean the end of your life. It's all we are trying to educate you on is to promote wellness and elongate your life and live your optimum best. As we always say, please subscribe to our channel, comment on any topic that you want us to also cover in the next episode, please share with your friends and family on your other social media platforms. And until I see you next time, stay blessed.